October is Breast Cancer Awareness Month, and early detection can make all the difference. For this week's Focus on Your Health, Meg Judy joins an MU Healthcare breast surgical oncologist to learn about how new 3D mammogram technology is helping doctors detect cancer earlier than ever before.
Focus on Your Health is sponsored by MU Healthcare.
I'm here with MU Healthcare breast surgical oncologist, Dr. Nicole Nelson. Thanks for being with me.
Thank you for having me.
Appreciate it. Okay, you're going to show me something in this screening room here that's pretty fancy here at MU Healthcare, right?
So this is one of our new mammogram machines capable of performing 3D mammograms.
Mammograms obviously can detect cancer so much earlier than, feeling a lump. That early detection has to be so beneficial for your patients.
It really is. So the size of lesions that we find on mammogram is actually quite small, usually pea-size or less, compared to when patients find a mass on self-exam or on clinical breast exam, it's usually about the size of a strawberry. If we can find things when they're still very small and haven't had the opportunity to spread yet, sometimes we can get away with less aggressive treatment.
I know nothing is one size fits all, and you have to take into account family history, genetics, things like that. So if somebody comes to you with that, how do you help them decide when they should start getting mammograms and how often?
Yep, so for the average risk patient, we usually recommend starting screening mammograms at age 40 and getting annual exams. For patients that may have a higher risk factor, so things like genetic mutation, a family history of breast cancer, prior chest radiation, we actually might start to screen earlier. So for our BRCA carriers, we actually recommend clinical breast exams starting in their 20s with annual MRI starting at age 25. For patients with a family history of breast cancer, we recommend screening 10 years before the earliest diagnosed relative.
So now everybody knows somebody who skipped their mammogram or forgot to schedule it. What would you say to give patients confidence when coming in to schedule it?
So first, mammograms are easy to schedule. You can schedule same-day appointments here in Columbia at Ellis Fischel Cancer Center or in Jefferson City at Goldschmidt Cancer Center. Second, they really don't take a lot of time, only about 15 minutes. And really, getting that annual screening and finding things early makes a huge difference.
I know roughly half of people have dense breast tissue. How do you tailor those screenings?
So for dense breast tissue, our go-to is really a 3D mammogram. It allows us to really kind of look through that breast tissue layer by layer. And if needed, we may add on an ultrasound or additional screening.
Because that dense breast tissue is a high risk factor, correct?
It is a risk factor, but it's only one of several risk factors. So usually when a patient comes in, we will calculate their estimated lifetime risk of developing breast cancer. For patients that are found to be high risk, we may actually recommend additional screening. So we may add on an MRI in addition to a 3D mammogram.
And what if it is cancer?
If it is cancer, then you'll be in expert hands with our teams here. We have fellowship-trained physicians that really focus on breast cancer. And so we give you access to the latest techniques. We do nipple sparing and breast conserving surgeries. We also have access to the latest clinical trials. And we'll be there with you to guide you every step of the way.
Wonderful. Thank you very much for being with us. I appreciate it. Good messages for the month of October. To learn more about MU Healthcare's breast cancer screening options, you can visit muhealth.org/get-screened. For Focus on Your Health, I'm Meg Judy.
Focus on Your Health has been sponsored by MU Healthcare.